We are here to give you the facts based on science. We do know that vaccine hesitancy is putting children's healthcare at risk, and we want to clear up any misconceptions that are out there. So today we're going to share 5 key things that every parent should know about vaccines so that we can keep your children safe. I'll start off with the first one, which is that vaccines are much, much safer than the diseases themselves. Vaccines teach your body how to recognize and handle infections quickly so that your immune system can respond faster and more effectively if you ever get exposed to the real disease. Vaccines are also put through rigorous testing and clinical trials to make sure that they're safe and effective way before they reach the public. And finally, even really healthy kids can get seriously ill or even die from what we think of as everyday illnesses like flu, COVID, measles, whooping cough. Now I'm going to turn it over to my colleague, Dr. Morse, who's going to share some more information with us.
Thank you, Dr. Yaldo. I'm Dr. Jennifer Morse, and I'm the medical director for 3 district health departments that cover 19 counties in central and northern Michigan. I want parents to know that vaccines are effective. Some vaccines can keep infections from starting, but most vaccines can't prevent all infections from happening, but they will keep us from getting seriously ill and reduce the risks of complications, including death. The chickenpox vaccination program is one example of a great success. Since it started in the United States in the 1990s, there has been an over 97% decrease in reported chickenpox cases. Another example of success is the whooping cough vaccine. Nearly all children are protected after finishing their vaccination series, and about 7 in 10 children are protected 5 years after getting vaccinated. This vaccine does wear off with time, and booster shot is needed. But neither chickenpox or the whooping cough vaccine will stop all infections from happening, but those that do happen are much less serious. We know that the COVID-19 and influenza vaccines reduce the risk of severe illness, hospitalization, and death, even if they cannot prevent all cases of illness. Vaccines are one of the biggest medical advancements ever made, but are very complicated to understand. We know that parents want to do what is best for their children and may look for more information to better understand vaccines. As people look for information, we want them to keep in mind that much of the rumors and incorrect information about vaccines start from or is spread by people that profit from spreading that information, either by selling other products that could be used instead, or from internet platform profit, or by some other means of profit. So I thank you for having me here today, and next I'll turn this floor over to my colleague, Dr. Nettleton.
Thank you, Dr. Morse. My name is Dr. William Nettleton. I'm an associate professor in family and community medicine at Western Michigan University Homer Stryker MD School of Medicine. I also serve as the medical director for Kalamazoo County and Calhoun County Public Health Departments. I want to be 100% clear with parents that vaccines do not cause autism. This is a rumor that's been dispelled by many studies. This rumor distracts policy and funding away from research and intervention that could actually help individuals and families affected by autism. Huge, robust studies spanning millions of children across many countries have not found a causal link between autism and vaccines. Scientists have learned that the hallmark of autism is dysregulation of brain development during prenatal period in the mother's womb before childhood vaccines are introduced. Another question I often get from parents is, it seems like kids get more vaccines now than in the past. That's a good question. And it's true that children do get more vaccines now than in the past. And that's okay. This is because we've gotten better at developing vaccines in 2 ways. First, we target immune protection more efficiently now. Over the years, scientists got smarter at targeting viruses and bacteria, exposing kids to fewer and fewer parts of the microbe, also known as antigens, to stimulate the immune system. Vaccines do not overload the immune system. Everyday life, in fact, exposes kids to far more antigens. Second, advances in medical research have also led to many new vaccines that further reduced childhood illnesses. For example, doctors like myself have never seen and no longer see breathing emergencies or brain infections due to the Haemophilus influenza type B vaccine, also known as the HIB vaccine. With that, I'll turn things over to my colleague, Dr. Nagapala.
Good afternoon. I'm Dr. Beena Nagapala. I'm a family physician in Clinton Township in Southeast Michigan, and also a medical director for Henry Ford Southeast Michigan school-based health centers. I want to stress to all parents that childhood vaccinations remain critically important, even though many vaccine-preventable diseases have become less common in the United States. Diseases like measles, rubella, and mumps may seem like problems of the past, but they still pose a real threat. These illnesses haven't disappeared. They've just been kept at bay thanks to widespread vaccination efforts. In fact, these diseases continue to circulate in other parts of the world. Cases of rubella, for example, still appear in the US, often brought in by international travelers. It is important to remember that the reason we rarely see these diseases anymore is because vaccines have been so effective. Without continued vaccination, we risk losing this protection. We saw this happen with measles. The US had eliminated measles in 2000, but in 2019, cases began to rise again, largely due to vaccine hesitancy, according to the CDC. Michigan itself saw 43 cases in 2019 of measles. If we let our guard down, these diseases can and will return. Vaccinations are essential not only to protect individual children, but also to maintain what we call community immunity. This helps prevent outbreaks that can cause kids to miss school, extracurricular activities, or even suffer serious long-term health complications. Let's work together to keep our children healthy and our communities protected.
Thank you, Dr. Nagapala. And also thank you again to Dr. Morse and Dr. Nettleton. As family physicians, we really take pride in the relationships that we build with our patients. And it's through those relationships that patients trust our advice. We hope that we've provided valuable information for parents during these confusing times. But I definitely want to urge parents to visit your family physician or your local health department to access childhood immunizations for your children. We make it a priority to ensure that every patient and child will always be able to access the immunizations that they need. And we recommend these vaccines because we care about our patients. We care about the children, not because of any financial gain that we get out of it. As a matter of fact, doctors often lose money because of the costs of purchasing the vaccines and storing it. Getting vaccinated provides us with the freedom from preventable illness and death. Everybody benefits, and the science is clear. Vaccines work. Again, I want to thank you all for being here, and we'd be happy to take questions from the group.
All right. If any reporters have a question, if you'd like to raise your hand or type something in the chat. Kristen with the Free Press, go ahead.
Hi, thanks for taking my question and for having this conference today. I'm wondering, could you tell me from your perspectives whether Americans can trust anymore the data that's being given to us and the recommendations that are being given to us from the CDC and from the federal government? And how are you each playing a role to ensure that people still have access here in Michigan to these important vaccines?
I can answer that. I think that the data is just not from the United States. It's worldwide, it's global. We have vaccine data from other countries, not just Michigan. And I think that we ourselves have personal experiences in treating some of these diseases. And and vaccinating children for these diseases. I think that also plays a big role.
All right, up next, we've got Kate with Michigan Radio. Go ahead.
Yeah, sorry, we've been having some audio difficulty on this end.
Yep, go ahead. We can hear you.
Great, thanks, Laura. Yeah, I am wondering if you guys are hoping that the state health department or Governor Whitmer's office will take some of the steps that we have seen from states like New York and Massachusetts in the last week to try to offer not just more clarity, but also just better access to residents. We have seen Massachusetts governor, New York's governor go ahead and say, listen, not only here's the guidance that we're going to offer about what vaccines are available, but we're also going to require insurers to cover them, and we're going to require pharmacies to distribute them. We're hearing a lot of confusion from folks about what they can and can't get, and especially with the restrictions around the COVID vaccine now, and ACIP about to discuss the RSV vaccine as well. Are you hoping that either the governor's office or the state health department will take additional steps to require Michigan insurers or pharmacies to keep these vaccines available to people?
Dr. Morse?
Yeah, I guess I can answer that question. I think there has been so much flux recently. It is hard to, determine what steps to take. I know ACIP is scheduled to meet soon. I know our state health department, Dr. Bagdasarian, has been very public about recommending the COVID vaccine. And every state does have different laws governing what pharmacists can do. And so I know each state has a little bit different. But we are hopeful that our state continues to be a leader in terms of guaranteeing access and coverage. So as things continue, I think we're all hopeful that Michigan continues to be a leader in ensuring access and coverage. And I know our medical organizations are here to support that effort as well.
Thank you, Dr. Morse. We've got a question from Eli from Bridge, Michigan.
Hi, thanks for everybody for being part of this panel. I wanted to kind of return to a question that I heard one of the reporters ask earlier, and specifically addressed it to Dr. Yaldo, in that I'm wondering if the Michigan Academy of Family Physicians believes or still continues to recommend following the recommendations from the CDC.
So the Michigan Academy of Family Physicians, what I can tell you is we follow our recommendations from the American Academy of Family Physicians. And so the American Academy has an immunization schedule that's taken data from and information from the American Academy of Pediatrics, some from the CDC, and some from some other organizations. And they've compiled it together to give recommendations. So based on those recommendations from the American Academy is what we recommend.
Thank you for that. And just as kind of maybe a broader question for the rest of the group, we're talking a lot about vaccine hesitancy and this trend in that direction. And I assume many of you are clinicians and have been talking to patients about some of this, some of those concerns. And I guess I want to understand why you all think that we're in this moment where there is less vaccine intake, knowing that there's all these benefits that happen once somebody does take a vaccine.
Dr. Nettleton?
Yeah, I'll see if I can help answer that. I think sometimes we have forgotten that vaccination has won us freedom from diseases such as polio that once plagued Michigan families. And my patients are curious. They ask good questions. They value nuance. And we're here as family doctors to guide our patients through all of those questions that are reasonable and through all the false, accurate, and misleading information that our patients maybe see online or in the news. And that's really our role as family doctors, and will continue to be the trusted source in an ongoing relationship with our patients.
Thank you, Dr. Nettleton. We've got a question from Autumn from News Channel 3.
Can you guys hear me okay?
Yep.
Okay, so my question is, what is your response to Robert F. Kennedy Jr., the Secretary of the U.S. Department of Health and Human Services, no longer recommending COVID-19 vaccines for healthy children and pregnant women? What would be your response to his stance?
I can at least start with that answer. And I think partly respond to some other questions about, trusting different data sources. At least when it comes to pregnant women, we know that during pregnancy and the period shortly after pregnancy, there is a very large increase in risk for complications from COVID infection, and that numerous studies have found that not studies to approve the vaccine, but post-use studies have found that the vaccine is safe in pregnancy. And so the data does support use in pregnancy, which is why the American College of Obstetrics and Gynecology does recommend that. In healthy children, risk of COVID, but there could still be risk. So we're living right now in a time where we may be seeing some statements being made, particularly in social media from some of our officials, that are not necessarily based in scientific evidence. And that has made it very challenging for those of us who are in the positions we are trying to help navigate this storm of information. So it is very challenging when those organizations like ACIP, like our HHS, who were once the heralds of evidence-based medicine, may no longer be that. And so we're trying to help translate those messages. But I know, at least speaking for myself, the messages that he has given about pregnancy are incorrect scientifically. There is no new evidence. The evidence supports use during pregnancy. And again, in healthy young children, there is still a benefit, but that can be more of a discussion that parents provider.
Yeah,
So you
what I'll
think that-
add is
Yeah, go ahead.
that I take care of pregnant women and children both in the clinic and in the hospital. And I think oftentimes the general public may not see what doctors and nurses see. And a lot of times we see preventable suffering. Sometimes we see preventable suffering and death. And that's the main reason why we're here today, is that we want to guide and walk with our patients. And we're there for our patients at some of the most vulnerable times in their personal lives and in their family lives. So with respect to pregnancy, I recommend my pregnant patients receive the influenza vaccine during pregnancy, COVID-19 vaccine during pregnancy, and the RSV vaccine during pregnancy.
I just have a follow-up question to that.
Go ahead.
Yeah. Do you think that this misinformation from someone in his position, Secretary of the U.S. Department of Health and Human Services, someone who's supposed to be a trusted source, is jeopardizing public health?
Yes. I mean, I don't have a problem saying that. Yes, I think there's been a lot of harm done to the trust in public health recently.
And they're going to, with these elected officials, they're going to do and say what they think is right. Just like we're here today saying and doing what we think is right, which is supporting evidence-based medicine and supporting the science. And that's what we're here for today. I mean, if anything, the message we can give to our patients is, look for that MD or DO. Trust your family physician, trust your primary care doctor. We are the resource for our patients.
All right. With that, we're about out of time. If anyone has any follow-up questions, feel free to reach out to me and I'd be happy to connect you with our panel of family physicians here. Thank you everyone for joining and have a great rest of your day.